All right. Good morning, everybody. This is Dr. Palacios, and we are going to be speaking a very sensitive topic, which is medical advocacy, a workshop on inform, empower healthcare visits so you know what to do to visit the doctor and be able to communicate the most effective way. Because as we know, you don't have much time with them, but you also need to get your message across. Okay, so let's get started here. We're gonna review some objectives. So at least this is what I like you to get out of this presentation. It is going to be long, but again, just take it piece by piece and listen to it whenever you get a chance. This video will be available for everybody on YouTube. So we'll go over what is self-advocacy and autonomy in the medical field. We're gonna also review a little bit of medical bias history and how that affects us. Also, understanding cultural and language barriers between doctors and patients, because as we know, in the United States, it's a divergent group. It's not only one, it's not a homogeneous society. It is mixed. There are many immigrants, there are many racial backgrounds and ethnic backgrounds. And these are things that we need to bring to attention. And then lastly, I'm going to talk about some core skills in order to advocate for yourself. And that includes medical interpreting services, which you may not know they exist, communicating your needs clearly, setting boundaries between you and the provider, and then seeking second opinions and alternative routes if you need to. So before we go on, let's just quickly do a quick overview of who I am. So I am a naturopathic doctor. I work in the state of Pennsylvania, not licensed, but registered. I also have a license in massage therapy, so I do a lot of my therapies and services with body work, which has been an incredible and insightful work for me. In my undergrad years, I did my biology major at the University of Millersville, also in Pennsylvania, but naturopathic medicine was in Connecticut, in University of Bridgeport. And then lastly, just this year, I was able to release my first book, The Longevity Manual, a naturopathic doctor's guide to biological resilience and medical advocacy. And one of the chapters that I review on this short book is all about medical advocacy and agency. And then my philosophy is simple. Education and compassion are the leading routes to true success. All right, let's get into the introduction and framing of this presentation. First, why medical advocacy matters. Because I want you to be aware that eventually care is going to be in your hands. You also have to understand that doctors are guides. They're humans. They're likely to make mistakes too. So at the end of the day, the real expert of your healing journey and your medical journey should be you, not the doctor's rules or orders. So I know it's going to be a little bit difficult for some of you to understand that because again, there's a cultural authority background where many of you believe that the doctor has the highest authority and therefore you just need to listen to what he says. And for the most part, it is true. But at the end of the day, you are the one I mean, it's your body, so you have to, you know best how to take care of it. And you should learn how to do that as well. Also, in the international communities, we see a lot of issues on advocacy because there's language barriers, there's biases that have been built, which we'll talk about shortly, cultural differences, and then healthcare providers are generally not trained in advocacy and other forms of like interracial and ethnic diversities. Now, advocacy as a partnership is a form of partnership. It's not a way to tell you how to confront your doctors. Rather, I want you to be smart about the way you ask them questions. So that way you can proceed or not proceed with the treatments that they're giving you. So you can always ask questions or say no. So autonomy in this case means the ability to have the final decision on what you do to your body. The doctors can say what you do, or they can order what treatment is the best, but at the end of the day, you are going to have your own autonomy to say yes or no, because this is your body and it is your health. Okay? So after that, we're going to be talking about some other issues that come up. And of course, understanding the healthcare system. So a little table here showing that compared to other high-performing countries, mostly in East Asia and Scandinavians and European nations, in comparison to the US, the universal healthcare is something that is quite relevant in those countries. But in the US, it continues to be a voluntary insurance. So people can choose to have insurance, they can choose not to have insurance. And because of the costs, the premiums, they tend to be very high, and people just choose not to have insurance. However, because of that, an emergency visit to the ER can basically cost quite a lot of money, and it can take years to pay it off. When it comes to access, in the US also is not doing so well. Efficiency is not the best either. Equity, there are some significant disparities, which we'll talk about, especially in the racial biases. And then the outcomes, despite having very advanced technology, lower life expectancy, it is still lower than those high performing countries. So there are poorer outcomes on this. And just quickly, how systems differ across the countries. They're either publicly funded, private, there you can also have private insurance, and then there's a mix of public and private, which in South America, at least I can speak from my experience in Chile. You can you have your ID number, and that is your number. So you have public services, which include healthcare, and then private services if you want a faster, also more expensive healthcare care or healthcare service. And then voluntary, like I mentioned in the US. You can choose to have insurance or you can choose not to have insurance. Now, cultural expectations around doctors. Again, this is something that I want to make it very clear because it is something that we've been just culturally ingrained that people with higher professions obviously have a very high level of education, high level of knowledge, and therefore deserve this high level of authority. Now, in many cultures, doctors are considered to be a very high level of authority. So you don't question that. You only do what is being said. But it can be also detrimental because, like I said, you know your body more than the doctor does. And if something doesn't feel right, something just isn't syncing up between what you're saying and what the doctor is telling you to do, that's when you have to start questioning rather than blindly follow. Also, direct and indirect communication in some cultures. Again, I'm not going to not going to specify which cultures. You will have patients just, nodding their heads or making like agreeable sounds like or just listen attentively and as the doctor speaks, but that doesn't mean that they're understanding everything. So that is also another cultural disparity that can occur because the doctor might think, oh, well, he's agreeing, he's nodding, he's understanding. Great. We're all in the same page. But their in their perspective, they're just listening, they're trying to understand. And at the end of the day, they may not say anything. And expectations about time and attention, again, that's a different thing. This is more on the healthcare services. Some doctors will take 10 to 15 minutes. Other doctors take a little longer, depending on the discipline, depending on the setting, and depending on the fee as well. Gender gap and age gaps are other things that we see quite a bit, especially with women preferring to have female doctors. And of course, it's completely understandable. However, please understand that it cannot always happen that way. If you are adverse to having a male doctor see you, just try to understand their situation in case you need to be seen by a male doctor, because at the end of the day, I want you to put your health a little bit more uh, than your culture in this sense, okay? Because it is a personalized journey. Okay. And then, yeah, so let's keep going here. Why people feel intimidated in medical settings. Again, there's something what we know known as white coat hypertension, which is a condition where your blood pressure is always high when you visit the doctor. And it's because of just the anxiety that you get, or the nervousness or the stress that you're going to get bad news. And that's a real thing. So you get high blood pressure readings because you go to the doctor's office, not because you really have it. You only have it when you're there. Also, people always look for the worst case scenarios. So when you go into a hospital, of course, you're also going to be looking at the worst case scenario, kind of like looking for your symptoms on Google and then saying that you have 10 seconds to live because you have a tumor in your brain, despite of just having a little bit of a headache. Same thing. Um, Also, in many hospitals or many medical settings, it's considered sick care. So once you're sick, you're being taken care of that. They're not necessarily to take care of the preventative measures so you can have a longer and more healthier lifestyle. They rather just want to take care of the symptoms and move forward. There's also cultural and language barriers that, again, we'll cover more that later, gender roles and biases. So language barriers. Again, like I said, sometimes the patients may not show they don't understand. Again, nodding, agreeing with you doesn't mean that they understand, but to a doctor, that's how they see it. That's how they perceive it. And this is why the services of medical interpreters are so underused, and they need to be used much more. Even if you believe you have a good level of English, don't feel hesitant to use a medical interpreter, because they are trained to translate the medical language into your simple terms. And yes, you can speak English at an intermediate advanced level, but medical language is a little bit different. So it's not, try to not be so prideful about this. Okay. It's okay to ask for help, especially you guys, men. I'm talking to men. Medical terminology is also quite complex, like I said. Not enough time. Again, many times you go in, 15 minutes, you get rushed out by the doctor. Of course, the nurse and other practitioners will be there to assist you in anything. And then misunderstandings are not usually addressed. And again, this is where the decline of healthcare kind of starts in, because a sick patient that doesn't get better eventually starts creating an avalanche effect on other influencing cultures and people not feeling confident to look for solutions, health solutions in their doctors. So this is why I bring medical advocacy, because you need to be informed and prepared. So ask questions. If you are feeling intimidated to go alone, bring a friend, a companion, somebody to be, somebody to just, remind you of things. And then use a medical interpreter if needed. And of course, always have your medical records with you. Nowadays, many people can just access them at the comfort of their phone. But if you have them on paper, obviously it's much easier to just sort through and then get your point across. Okay, so I'm gonna change the topic just a tiny bit to speak about the history of bias and racism in medicine, at least in the United States. But of course, in many cultures, this has also been true, and it is continuing to be true, just in the more subtle level. All right, so history unfortunately has gotten in the middle of what true biology and true science really is. Culture and traditions just unfortunately are more ingrained than what science and objectivity tends to be. So Unequal treatment of pain has been the disparities of biases, underdiagnosis in marginalized communities, harmful stereotypes influencing care, mistrust rooted in real experiences, and then modern disparities that exist in today, such as treatment recommendations, access to specialists, quality of communication, and then follow-up care. These are all things that are not the same among the different communities. Although as doctors and healthcare practitioners, this shouldn't be an issue. All right, so racial biases in pain and treatment. And before I get into the specifics, I just want to mention that this these forms of biases were from medical textbooks back in the 50s, where they were still comparing different brains of different so-called races of humans and saying that because the size was this way and because the connection was this way or because the shape of this was this way, the intelligence mattered. And therefore, they created this hierarchy of intelligence and superiority and inferiority. And that stuck in some people, especially those who just had that privilege to be in power and take a, take advantage of that. But keep in mind that at the end of the day, especially when it comes to brain dynamics, no race is superior, no race is inferior. Everybody has the same amount of intelligence, whether it's a child from Asia, a child from the indigenous countries or the indigenous Andes Mountains, they all have the same capability to learn and have intellectual discussions. So that is completely erroneous. And unfortunately, it is true that in some other countries, they still believe this. So let's just spread the word and to say that this is just absolutely unnecessary. Now, there are differences in ethnic and cultural or racial backgrounds based on the genetics on adaptability and perhaps liver enzymes, which process alcohol a little bit different, and digestive propensities, but these are minimal. These are minimal, and these are just genetic variations that just happen because of the environment. But again, when it comes to the level of intelligence and brain capability, absolutely no difference between among humans. Okay? Okay. So moving forward. Now, because of this, Black patients tend to receive less pain medications than white patients for the same conditions. And again, a lot of this bias comes from the fact that the marginalized stereotypes of Black communities are that they consume drugs, so they might overuse it or they might abuse it. So they're going to give them less medications or less pain medications or less stronger medications than their white counterparts. Women's pain tend to be likely dismissed or labeled as emotional. Again, the whole movement of women's hysteria was just a way to disregard real symptomology and hormonal fluxes in women's health. And then language barriers lead to undertreatment of pain in non-English speaking patients, which of course there's still some biases of, you can't speak the language, therefore the communication is going to be a little bit difficult. And that I can understand that to some extent. Now, underdiagnosis in certain communities, heart disease in women, especially Black women. This is a fact. It happens. They Unfortunately, there's more likelihood of Black women to experience high levels of stress. And this is from a history of systemic racism in the US, because they tend to be alert. They have their stress hormones elevated at a higher volume than the white women counterparts. And of course, years and constant watchfulness, constant vigilance leads to that form of stress that affects your arteries and therefore creates blood pressure issues and eventually heart disease. So the connections are there. And now we're seeing the proof of this systemic racism affecting the health of the minorities and Black individuals. Also, autism and ADHD is underdiagnosed in children of color or girls. Mental health conditions in immigrant and minority communities also tend to be not taken as serious. Now, stereotypes influence and provider assumptions. Some patients exaggerate or underreport pain. Again, sometimes we can categorize women as being hysterical, therefore they're going to exaggerate their pain. Again, stereotypes. Or you have the opposite, where the patient is culturally not supposed to show pain, so he's going to kind of like downplay it, which of course is going to cause other problems for the doctor because they're going to not take it as seriously either. There's also stereotypes saying that some patients are less likely to follow medical instructions than others. And again, it's usually because of there's a misunderstanding and there's not a communication between doctor and patient. That's usually why patients don't follow their orders correctly because they don't know what's going on. And then some patients are naturally healthier or less at risk. And this is a big stereotype in the Asian community. I believe in the Korean community, they are believed to have, you know, very high work ethic, very strong, they're very stoic, and they eat healthy. So therefore, when they go to the doctor and the doctor notices all of these issues. They don't take it as seriously, but they're because they think of like, okay, I think they're gonna get better eventually. This is just a little fluke in their health. Again, it's a in a way positive stereotype, but it's causing issues because long run, this person really can lead to serious complications later if it's not treated correctly. Okay, other things, delayed diagnosis of heart attacks in Black women, lower likelihood of receiving advanced treatment for chronic conditions, again, in other marginalized communities, and then mental health diagnosis and underdiagnosed and undertreated in communities and immigrant communities. So again, just bringing it all together here. How these patterns affect us as medical practitioners and healthcare providers. Again, if you're a healthcare provider, please listen to this carefully. Patients don't seek the care they need. They share less information with patients. They start mistrusting us. So there's less trust, more health complications. Okay. And then it just goes on through generations. Now, not only their parents are not going to come to us, their children aren't going to come to us, and then their children aren't going to come and trust us anymore because of all of these patterns of mistrust. Now, awareness as empowerment. So what I want to bring it here is understand and recognize that biases are not personal failures, but part of a systemic experience. Although today I do have to put up some level of accountability as a healthcare practitioner, because again, you have your license, you have your certifications as a nurse, as a doctor, as a health provider, because you work very hard and you study very hard. Now, you should understand also that these biases also need to be taken away, and you have to study very hard and work very hard to remove those biases out of your mind. Also speak up and make informed decisions, again, as patients, very important. And then medical process advocating becomes more essential. So core skills of medical self-advocacy. This is where we're going to get to the meat of the topic. So again, this is going to be here. Feel free to use it. Feel free to modify it in your own words, in your own language. Doesn't matter. This is for you, okay? Now, it may help to bring a piece of paper with you to prepare your top 3 concerns. And you can say simply, I prepare my top 3 concerns that we can start with. So, number 1, write each statement clear, specific, and to the point. So, don't say simply, I have a headache as a patient. Please don't just say that. Try to give us a little more detail because we're going to ask you that. We're going to keep going with the details. And just try instead, like, okay, for the past 3 weeks, my headaches keep getting worse after my work shift. Great. That actually is very important for us to know. Number two, for each concern, jot down the essential details using a simple framework. So the three things that are going to be very important to tell your doctors. When this problem started, what makes it better or worse, and then how it affects your daily life. Again, these are things that matter to you too. So we need to address that. And then three, prepare your goal question. So you want to know like what could be causing the pain and whether imaging or physical therapy might help. Again, that's completely acceptable. You can also say, what is the diagnosis? What is my actual medical issue? Are there any kind of treatments available too? So again, these are things that we need to train as patients to learn to advocate for yourself. So here is a sample of timeline notes that you can try. And this, I put a simple example here for a patient with migraines, okay, which is not simply just a headache. It's much more than that. So the start date of the migraines in this patient started around January 2025. It became more frequent in the past 3 months. And then now this person gets 2 to 3 migraines per week, and they can be from 4 to 12 hours if untreated, which is an important part to say untreated. Now the sensation, location. It feels like a throbbing pain on the right side of the head. Pressure behind the eye, behind the right eye, and the intensity is 7 to 9 out of 10 at the worst. And again, the scale use of pain is from 0 to 10. 0 meaning no pain, 10 being like I have to go to the hospital kind of pain. It's unbearable. Other things, nausea, other symptoms that maybe your doctor can say it's related or maybe not. But still, write it out. When you have the migraine, well, they have nausea or sometimes vomiting. They are sensitive to light or sounds. They have blur vision before the pain starts, what we call an aura, or little glitches of light. And then kind of moving forward is some other notes that helps, such as triggers. What do you suspect could be the trigger of this headaches? Okay, could be skipped meals. Maybe I got head attack from that. Poor sleep, strong smells. Those are all triggers for this person to get the migraine. What makes it worse? So in other words, what makes the pain more unbearable? Much worse. The throbbing just much more uncomfortable. Bright lights, screen use, physical activity. In this case, will be overexertion. So working out too much. Then on the other hand, what helps? Lying down in a dark, quiet room and a nice pack on the forehead. Medications tried, acetaminophen, which is simply Tylenol, and then it caused a minimal relief, so just a little bit, but I don't have any prescription migraine medications tried yet. Impact on the daily life. I missed 3 days of work in the last month, which of course is big, it's a big deal. And avoids social plans due to the unpredictability of the migraines, which of course can also have a huge impact on their daily life and social life. So the goal of the visit, understand the possible causes and discuss preventative options or prescription treatments. So asking questions in plain language. Okay. Again, these are things that you can use, and I'm not going to go over each one of them. Feel free to do so yourself, but feel free to use these points for your notes if you're going to see your practitioner. And then requesting alternatives, which again, it's in your right to do that. You're not challenging the doctor. Just say, what else is available? It's not mistrust. Just want to have a better understanding. And then we have the whole branch now of alternative medicine known as complementary and alternative medicine. Other areas called the holistic medicine. And that includes services that are outside of the conventional medical framework, which is osteopathic and medical or allopathic degrees. So it includes complementary, alternative, holistic medicine includes acupuncture, naturopathic, chiropractic, and then other practitioners who also have their training and professional services. And find out which option suits best for your goals. So are you looking for the best medication despite side effects? Are you worried about the side effects? Or are you worried about how expensive it's going to be? Because economic costs are important too. Now, an informed consent, this is something that you sign every time you visit a doctor. The provider explains the action and treatments. So you're provided with the benefits, the risks, and alternatives of your treatment. When you sign your consent, you simply show that you understand what is being given to you. And of course, you have your medical interpreter. They should be able to read that out loud for you and give you the full disclosure. And you always have the right to decline treatment. This is important. Just because you signed it, it doesn't mean that you have to go through this particular treatment. You can always say no at the end. Okay? Remember that. Okay, now bring in support person. There are good things and bad things about this. The good thing is the person that you bring will help you remember some things that maybe you forgot. So it's good to discuss with this person. Hey, I want you to just, um, help me navigate the conversation with the doctor. And if I forget to say this, please remind me. Great. So it helps you stay on track. Just remember that they are not your advocate. They are not to be part of the conversation. They are not supposed to bring their medical problems, like say, oh, I have been having this headache and it's been going this way. And then the other person starts pitching in, oh yeah, I have a headache and it kind of sometimes go this way too. And it just gets chaotic. And of course, you know, it just doesn't go anywhere. Now, for keeping your own medical records, useful documents to have with you at all times is going to be your medication list. And when you name medications, just say the name of the medication. Doesn't mean it doesn't matter if it's the general name or the brand name. So a Tylenol or acetaminophen, whichever one you're more comfortable. Write down the dose, so the number, how many milligrams or micrograms you take. The reason for taking this, this is important, okay? Please do that. And then when you started the medication, when are you stopping it, or is it continuous or non-stop? Another important document is to have your diagnosis and problem list. So what are the problems that you've been experiencing? Another one is allergies and reactions. So are you having any problems, any allergies that could be deadly when you are found, say, unconscious and you need to be given some kind of medication to either wake you up, take you out of this allergic reaction. So these are all important things, life-saving documents. Lab results and imaging, especially abnormal or trend-based. And then visit summaries or discharge instructions, which just tends to be about one paragraph. And this is the assessment aspect of the SOAP note for healthcare practitioners. That's the one that you really want to give to your patients when they ask for summaries. Okay, now organize your condition by date or condition. So you can make a timeline. So saying the year, the month of the visit test, this is what happened. Or you can also have in the condition, this is how I'm doing for migraines. This is what I'm doing for my GI problems. So gastrointestinal. So say my ulcer. This is what I'm doing for my orthopedics, which will be say an injured shoulder. Like that's what I'm doing for this. If you have it in separate lists and documents, it's going to make things much easier for you and the provider. And then track changes over time. Medication changes, side effects, symptom frequency, severity, and then what helped and what didn't help. These are all important aspects because many doctors will not go back to look at all your records, especially if you've been going there for years. They should, of course, but realistically speaking, they're less likely to do so. So this is why you need to be your advocates in this case. So because then the doctor might say, oh, well, let's try this medication if this didn't work. But then in your records, you have it. Oh, yeah, we did it before. Didn't do anything. So again, that's you're already ahead of the game in this sense. And you're promoting your own health ahead of anything else. Now, advocacy without feeling pushy. Okay, this is an important part too. So, speaking up, learn to speak up. Be respectful. You're not challenging. Just just try to get your point across without being disrespectful or impolite. And you can use these questions like I've used here. So be curious, not challenging. So you can ask, hey, doctor, could you help me understand what this means? Or you can also ask the nurse or the PA, which is the physician assistant. Sometimes they can act like the doctor at some visits if it's not too serious. And again, you can ask them the same thing. Also ask them, what are the options we can consider? How does this treatment work? Again, you're simply clarifying. And then slow down if necessary. So ask, hey, could you go over that one more time? Could you explain that in simple terms? Other collaborative phrases to have with you is, can we look at this together to make sure I understand the best option? I like to share what I like to share what I'm experiencing so we can figure out the next steps as a team. And would it be possible for us to explore a few alternatives? Inviting questions to simply advocate for your health and other options available out there. If you have concerns, express them calmly, saying, I appreciate your explanation, but I'm still worried about this symptom. Or you can say, I hear what you're saying, doc, and I'd like to make sure we don't overlook this issue. I'm feeling unsure about this plan. Can we talk through it a bit more? And then handling interruptions or dismissal. So persist calmly. It's a form of self-advocacy and not confrontations. So some questions you can also ask. I just want to make sure I fully understand what's happening. To be clear, this has been happening for 3 months and it's affecting my work. If we're not exploring this more today, can we document it and make it a plan for the next visit? These are things that are completely okay. And again, there are times you will not be able to discuss all of your goals. Like I said, you have three top concerns. And in visits, sometimes they can run short, especially if one of those concerns takes more time to deal. So you can simply say, next visit, can we explore this particular concern that I had for this visit? Which again is a complete understandable way. Setting some boundaries, again, remember you may think that they are high level of authority, but I'm gonna say the highest level of authority right now is your health. And they're there to help you reach your health. That they're not so and that's a goal that they should understand too. So that's why I'm saying setting boundaries for the common goal, which is your well-being. Okay? No ego battles. No one's right or no one's wrong in this case. What's right is what's going to work for your health. What's wrong is what's going to take you away from health. Okay? So setting up boundaries is not rude. It's a way of protecting your time, energy, and autonomy. You don't need permission to advocate for yourself. So try these ideas. As I mentioned, I'm not ready to move forward with that yet. To manage my health better, I need expectations in plain language. Or I need more time before making this decision. That's completely understandable. Take the time you need to find the right answer, whether this is right or not for me. If you decide to decline the treatments, be simple and respectful. Thank you for explaining this. I'm not comfortable moving forward with this treatment right now. I appreciate the recommendation, but I'd like to decline this option at this time. Or you can say simply, I'm going to pass this for now. You have the right, like I said, despite having the informed consent signature, you still have the right to say no, to ask questions, and then to change your mind later. You can say yes now. Next procedure, you may say, not sure. I don't think I can. And you can, call and cancel or ask more questions. So when to switch providers? If you don't feel heard, that's a big one. You don't feel heard, respected, or taken seriously. Then, of course, it's time to seek a new provider. If you don't feel the care is collaborative or transparent, again, look for a new provider. Poor follow through and delayed tests. So they're taking time, they're changing your schedule because another person was scheduled for that time, yet they still put you in there. Now they have to delay it a little more. It's it's a problem with their office and their managing. Nothing to do with you as a patient. And the best way to reflect that is just to move forward, move ahead and get out and look somewhere else for care. Also, you just are not comfortable being there. It could be a vibe, quote unquote vibe thing, energy, whatever you want to call it. If you don't feel it, you don't feel like you're welcome or something feels off, your intuition is a real thing. Your gut feeling is a real thing, and you have to listen to it. And then your goals have changed. The doctor can be specialized in this, but now you want something different. So you just simply move forward. And lastly, some special considerations for international patients. Okay, so if you're a patient who would like to, or somebody who would like to have more information and advocates for the international community, and by that I mean immigrants who have come here and have very low level of English. Also, they are not used to a complete new culture. Please be an advocate for them. Please help them out. And this is information for them too. So hopefully they'll be able to receive this as well. Now, navigating an appointment with limited English, like I said, put your ego aside, even if you have an advanced level of English, still get an interpreter because you have the right to do so. These are qualified, trained medical interpreters at no cost. They don't cost anymore. These are services by the hospital. By law, they need to have this service. So in-person, phone, or video visits. The interpreter may be next to you, a person. Sometimes they will do a phone call, so they'll be on the phone. And then now, more commonly, they may have a video on an iPad, a video call that you can look at the interpreter, and the interpreter can interact with the two of you. You can also request for an interpreter in advance or at the visit. Avoid relying on family or friends for medical interpretation. This is a big one, okay? Mostly this occurs because they're not trained in medical language. Unless, of course, your son is a doctor or a nurse, but even so, to some extent, that's not going to work well. Because typically, immigrant families, they will go to their doctor's appointment and then they will bring their kids to translate for them. That's the most common scenario. And that's just not going to work well for translating such complex medical language to a child who has no idea what that means. So they're just going to tell their mom or father this is what they think is going on. But there's going to be miscommunication and therefore poor quality of health from that or health service. Speak directly to the provider, not the interpreter. So when the interpreter is there, again, the interpreter may be sitting next to you, and then in front you have the doctor. Now you are talking to the doctor as the patient. The interpreter is simply just translating or interpreting the words. And then the doctor should be speaking to you, not the interpreter, to you. And that's how it is the back and forth. Okay? If you have questions, the interpreter can say, and if the interpreter isn't clear about some explanation, he may also just pull up a dictionary or some kind of on his phone, just something to clarify. And that's completely normal because, again, medical technology continues to advance as there's new changes and new treatments that occur on a daily basis. Okay, so basic language on insurance. So again, this is just for people who want to know a little bit about it, but I'm not going to spend too much time on here. Just wanted to put it out there to kind of complete the self-advocacy, because these are terms that you do need to know, especially if you have insurance. So basic terms. What is premium? It's what you pay for the insurance, typically monthly payments. Deductible is what you pay before the insurance starts paying. Copay is the fixed amount you pay at a visit. It tends to be small, like $20, $30, so on. Coinsurance is the percentage you pay after the deductible. So if you used up all the money that the insurance is supposed to pay, then the coinsurance, they're gonna give you a little percentage of that later. So understands who pays what. You pay the premiums, the copay, and then part of the bill. What insurance pays is the rest. And of course, it's all based on different rules. Usually when you have an insurance, they will give you a pamphlet or a list of different providers with according to their specialty and addresses. And those are considered in-network, and they tend to be less costly than out-of-network. And then always ask, is this in-network and covered when you are trying to make a phone call to a doctor's office? Again, ask about costs before the care. So what's this visit going to cost or the tests going to cost me? Is this covered by my insurance? Is there a lower cost alternative? Now, if the medical office cannot give you a straight answer, you always feel free to call the insurance agent and just ask them yourself. Sometimes that can happen too, where the doctor's office may not know if the insurance is going to cover because they accept the insurance umbrella, but every individual plan is different. So your plan may be a little bit different from what the office accepts. So that's why it's just to be sure and 100% certain, just call your insurance and tell them, hey, I'm going to this doctor. He's doing this test. Is it going to be covered or not? Or how much is it going to be covered for? Just again, advocate for yourself. Be proactive in this sense. Because again, if not, you're going to get an expected bill that it's going to be quite detrimental for your mental health. And then speaking of that, it's a review of bills and explanation of benefits. So it's not an EOB, it's not a bill. It just explains how the insurance processed the claim. So you can compare that to the actual bill and then question errors or charges you don't understand. Again, call the insurance for that. Now, cultural differences in expressing symptoms. Pain descriptions vary according to emotional and physical discomfort. So there's burden and pain. Some cultures may categorize them in different levels. Some cultures don't seek medical care until their arm is literally falling off, like just broken or unable to move. In other words, a problem has been going on for so long that they ignored it until they just couldn't physically move it anymore. And again, as practitioners, healthcare providers, just ask out of curiosity, how does this affect your daily life? And most importantly, what do you think is happening? Make them part of the treatment. Okay. There are, again, understand that despite having medical language across the culture and across the world, the cultures, since culture is, of course, ingrained in people, there's still quite a lot of different perspectives of medicines, different perspectives of healing, and that involve supernatural forces. And those are important questions to address too. Like if the patient thinks that he is being visited by a ghost or a spirit or a demon or something, don't simply just take it as, oh, hallucinatory or, discharge that, oh, that doesn't make sense. That's crazy. It's part of their experience. You can't just disregard that. So really, really try to understand their perspective of what's happening. Because again, if their mind is working with you, with the medicines that you give them and the treatments that you're giving, then they're going to listen to you better. They're going to trust you more. And if you tell them, well, okay, I can understand why you can say that. So let's try to get better and let's try to get you healthier so this demon or spirit is not controlling you as much. Something along those lines. So it's important to ask that particular question. And then preventative care may be just unfamiliar to many people. Now, in the hospital settings nowadays, more and more hospitals are accepting the alternative medicine route, the holistic medicine as preventative care. And that's uh, it's a wonderful step. We still have a long way to go, but we're getting somewhere. Finally, some closing words before I check out of here. You are the true expert of the body, okay? The highest authority here is your body, not your doctor, not the nurse. Nope, your body, your health. You know what's best for your health, so advocate for that. Be an active participant, not a passive recipient. And I state that very clearly in my book. You have options, explore them, because your health is the most important aspect of your life. Because eventually, when you're healthy, you have 99 problems, but when you're sick, you only have one problem. And with that, um, just going to say that I have my private consultations that can be done online or in the Lancaster area of Pennsylvania. And this is the book that can be purchased in Amazon. Feel free to check the link below. And I do body work again, but I also do naturopathic services, and I tend to synthesize them because they're great for preventative and chronic care. And like I said, this kind of medicine is preventative care, and as preventative as I can be, being your own advocate is the best prevention to avoid medical error and medical issues for your health. Okay, so thank you everybody for your time. I am checking out of here, but any questions or the comments that you would like to dwell on or talk about, feel free to leave them on the comments, and I'll see you all next time.